Welcome to the Today episode. And today we're exploring a topic that our guests are hoping to raise awareness of, and that is male breast cancer. So it's in fact Male Breast Cancer Awareness Week this week. And while breast cancer is most common in women, it does also occur in men. And what we want to discuss on today's episode are the emotional, social, and psychological challenges unique to men. Um, and without that increased awareness and consideration, how that could be left sort of unattended to. So we're joined by three incredible guests today. We've got Kerry, Dave, and Matt. Dave and Matt have experienced a breast cancer diagnosis themselves, and then Dr. Kerry Quincey is a health psychologist who researches this subject. So, welcome everyone. Thank you very much for joining us. Can each of you tell us a little bit about yourselves and your connection to the topic we're discussing today?
So, as Bryony said, I'm Kerry. I'm a senior lecturer at Democratic University in Leicester. I'm a chartered psychologist and I specialise in the area of health psychology. And my PhD research focused entirely on men's experiences of living with and beyond breast cancer diagnosis. And through carrying out that research, I came to know a number of the men who were participants in the research, and born out of that, co-founded the Men's Virtual Meetup, or the Men's VMU, which is an online monthly support resource for men living with breast cancer, of which Dave and Matt I came to know through that connection.
I'm Dave. I'm based out of Bristol, although I'm actually a Yorkshireman, proud of it. So my breast cancer journey started in August 2015 when I was on holiday and discovered a lump in my breast. I consider myself quite lucky in two counts. Firstly, because I was aware at that point that men could get breast cancer. I kind of crossed my path, and also, as a child, I'd lost a brother to leukemia, and my mother hammered into me all my life that if anything unusual happened in my body, I needed to get it checked. So I kind of grew up with that thought. So as soon as I found the lump, as soon as I got back from holiday, I went and saw my GP. And I think a lot of men are actually told this, that it was, you've got fatty tissue. And anyway, the long and the short of it is I started my journey there, and I've been involved with Kerry and the VMU since its foundation, almost exactly 5 years ago. I've also been involved a lot with breast cancer awareness through a number of charities. I did the moonwalk, which really kind of got me into contact with lots of charities. And I also now have sat on the National Institute of Clinical Excellence Breast Cancer Committee, plus some other stuff. So it's been life-changing for me, not all negative.
I'm quite new to cancer, I suppose, in terms of my diagnosis. I was diagnosed on the 23rd of December of last year. And in January, I was told I had stage four. So basically, since then, I've been on chemotherapy, and I'll be on chemotherapy for the rest of my life. Um, just because of the type of cancer that I've got. So I've got an inductal carcinoma in my right breast, and that spread to my spine, and my pelvis, and my ribs. And actually, on the current treatment that I'm on, I'm in this weird kind of cancer limbo where I was told by a doctor quite recently, as last week, that I don't have any metabolic signs of cancer in my body, which is amazing. However, that's because of the chemotherapy. So I'll be on the chemotherapy until that stops working or something else potentially comes along. So I'm kind of weird cancer limbo at the moment. That's me, I suppose.
Well, thank you for sharing that. It's really generous of you to share that, what can be a really personal and soundingly sort of painful experience for you. And Dave said about, his experience of how he found the sign of it. Do you mind saying, Matthew, how you
Oh
found?
yeah, sorry. So basically, I was actually working out in Chicago, so I'm a chef by trade, and we'd opened up a new restaurant out there. And I was out there for about 3 months, and towards the end of the time, I found a bit of a lump in my chest. I didn't really think much of it because I've actually got a couple of fattiest lumps elsewhere within my chest. However, my nipple started to invert, and I thought it was a bit weird. My partner thought it was a bit weird, so I went to the doctors. The doctor referred me straight to Lewisham Hospital, to the cancer clinic there. I had a bit of a rough time at Lewisham Hospital in terms of um, I struggled to get the appointments that I needed to be seen, to get biopsies and other bits done. And then I kind of complained to my doctor, and they transferred me to Guy's, and Guy's have been fantastic. So in terms of the speed and the pace of everything, I felt like I was having to advocate for myself and chase all my appointments. And when it came to Guy's, um, they were really on it for me. So kind of I've had a bit of a mixed experience with regards to the diagnosis and having to advocate for myself, and then finding that actually there is really massive disparity between hospitals as well, in terms of you kind of get a bit of a postcode lottery when it comes to your treatment plans. So yeah, it's been interesting and um, like throughout my diagnosis, it's been a kind of an emotional roller coaster of having six cycles of my first treatment, Dr. Taxol, and my cancer getting worse, and then having 6 cycles of Enhertu. I'm now on to cycle number 7, which I had on Monday. Um, of actually, oh, you kind of don't and do have cancer. So it's a kind of a real emotional roller coaster.
And I was thinking so most of the sort of people we work with are in forensic settings and how you've struggled and to get that sort of diagnosis and get the care you needed and having to advocate for yourself. I was thinking how difficult it must be to come forward in the first place and say that, for men particularly, and then to find that you're not sort of supported in that must be very difficult.
I mean, for me, it's weird calling it breast cancer because it's kind of gender specific. Like if I think more men would probably come forward if it was called chest cancer,
Mm.
just because it has a connotation of it only applying to women,
Yeah,
even though men have breast tissue as well. So there's kind of a misnomer there in terms of men not really realizing it affects them, I suppose.
yeah. I think we've got to be careful with the term chest cancer. It's something that we've fought quite hard against because it differentiates it as a different cancer.
Mm.
And the battle is to make sure that people understand that actually men get breast cancer, not chest cancer. And again, I know you're coming from, Matt. Again, we get that. But obviously, over a longer time, we've had this discussion about
Yeah.
breast and chest cancer. And I think it's safer to call it breast cancer because there is no distinction. As the treatment that Matt's gone through, it all right depends on the type of breast cancer you've got, but in essence, it tends to be fairly standard mastectomy, chemotherapy, radiotherapy, and then on to some form of long-term drugs. I mean, there are variations on the theme, but for the vast majority, that is the model, which of course is the same for women. I think the only major distinction, and the discussion of whether actually this is discriminatory, is that when a man gets breast cancer, the surgeons are far more prone to just take off our breasts, not they don't think it's so important. And there's now actually a move to say, hang on a minute, men should be offered the simply take part of the breast away option in the same way that women are.
Mm.
So even to that extent, things are kind of coming together.
It sort of made me think about, and I know we've spoken about this before as well, around how pink breast cancer charities are, and
Yeah,
sort of what people might be thinking about, like funding research and supporting breast cancer charities because it's pink from the outside in. It sort of
yeah.
feels quite exclusionary almost, or sort of
I th-
female dominated, maybe.
Yeah, I think again over the years we have lots of discussions on this. I think we as men have to recognise that we are 350 a year out of 50,000, so we can't expect all of a sudden it to become pink is the colour of breast cancer. What we do tend to say is pink with a touch of blue. And you'll notice, I think, for example, certainly, I think if you go on to the Breast Cancer Now website, for example, you'll find that on the relevant pages there is touches of blue in there. But we don't expect, we have to be realistic in our expectations. And again, Matt will perhaps have a different experience, but going into a breast cancer clinic, I have no problem with the thing being very pink or feminine in approach. What I have a problem with is speaking to the person behind the counter who speaks to my wife, not me, because she assumes that it's my wife that's got the breast cancer, not me. So that is the battle. Those are the battles we can reasonably win. I say expecting them to change, make breast cancer clinics gender neutral, I don't think is reasonable. We have to kind of fight the battles that we can win. What your experiences on that, Matt, is? Have you found the same?
So when I was in my appointment on Thursday, when I went up to the counter, the woman asked if I was there for dermatology, even though it's the breast clinic. So yeah, it does happen all the time. And I think there is, because I tend to go with my partner who is really supportive of me, it does always tend to be the first look is, oh, is it for her, not me? So it kind of, I do think there is a stereotype that it is just women. I mean, I did a course with some new students at UCL last week, where we had 10 cancer patients in a room with 30 new students, and we were discussing our diagnosis and what we'd been through. And in the room, it was 10 of us, two men with prostate cancer survivors, and seven women and myself with breast cancer. And as we started the conversations, even with some of the women that had breast cancer, it was, oh, you've got breast cancer. So there is still kind of a misunderstanding that it is just women, and there still is a kind of limited amount. I mean, if you go on the Breast Cancer Now website, you scroll right the way to the bottom, and then you see the men's bit. So it kind of, and then that is completely understandable because of the number of people there is. But I think just in terms of creating that awareness of having men and women at the top, and then having the bits and areas it is, kind of having a bit of a focus on the fact that it does affect more than just women on these pages is really beneficial.
I think the men are incredibly accommodating of what are, by no real need, female spaces. They don't need to be gendered. They are hospital clinics. You shouldn't have to apologise or, make reasons for why you should be there. It should just be accepted that you are a patient who has breast cancer and you have walked through the doors of a clinic, and you have just as much right to sit there as another who is also diagnosed with breast cancer. I understand that for branding reasons, for charities, for awareness raising, that the pink ribbon over a long time has become the symbol of what we understand represents breast cancer. And as Dave said, there are touches of blue here and there starting to show through, which is great. But a lot of the time, it seems to be the case that marketing of brands are less willing to change their brand identity, more so than the fact that pink is a representation of breast cancer, because it's just more familiar. But that is something that they could change. And actually, psychologically, for patients who walk into a clinic where they don't feel that they belong, where they feel that space is not for them, can be incredibly damaging, and it can be off-putting. It can be the very reason why people don't seek support in the first place. So I do think, whilst I see Dave's point entirely about perhaps making it gender neutral is perhaps maybe a bit too ambitious at this stage, I do think maybe they could just tone the pink down a little bit, or tone the femininity of it down a little bit, just so that space felt a little bit more inviting to whomever it is that attends that clinic and however they choose to identify. There are a lot of women who do not subscribe to to the pink side of the things. You know, there are lots of women who consider themselves very feminine who aren't so keen on the colour of pink, and they don't feel that that represents their feminine identity. So I do think there's a large amount of work to be done there, but I do also think in terms of what Dave said about the way in which people are approached or discussions take place within the clinics. Both Matt and Dave just said there how, you know, their partners are kind of looked to at the counter rather than themselves. We also, you know, many of the men have recalled on a number of occasions how when their names have been shouted out on a list, it's, oh, Mrs. Such and Such, and it's just the assumption that it's a woman that's turned up for that appointment rather than a man. So yeah, the education side of things, again, the assumption, like Matt said, you turn up to the desk and it's, oh, you can't possibly be here for a breast appointment. And to you know, to take Matt's point from earlier about chest cancer, I think there's something like there's over 200 cancers in that region of the body alone that could potentially come within the chest zone or area of the body that we might, you know, more commonly refer to as the chest. So whilst that terminology might be more you know, favourable in terms of language and what men are used to referring to themselves as, anatomically men and women both have breasts, and what we should be doing is normalising the language around that and making that less unusual, less feminine. It's only the difference is that the female breast is more fully formed than the male breast in most cases, but both men and women have that. And I would kind of, you know, as Dave said, this is a conversation we've had back and forth many times. But actually, rather than moving the language on or trying to change the way that we say it, let's just be upfront and honest about what this cancer is and not have people shy away from it, because that's how you remove the stigma, the shame, the feelings that men report as being associated with having what is largely viewed to be a women's cancer when we know it absolutely isn't that.
I think the one thing that annoys me is there is no excuse, particularly 10 years after I was first diagnosed, for Matt to walk into a clinic and for the staff there still to refer to his knife, not him. That's just really poor training. When somebody's allocated to a clinic, an NHS member of staff, they should be properly briefed. And part of that briefing should be, oh, just to make you aware, men do get breast cancer, and you know, you may well get men come in. We are rare, and I think, you know, typically in a major cancer centre, I think they might see one or two a year, maybe slightly more in London, but certainly in my region, which is the southwest, you know, we are a rare breed. But it's still important that that's the case.
And could you tell us a bit about some of the risk factors which, you know, would make it more likely that someone might get breast cancer?
Firstly, genetic. I actually learnt this only today, that men are more likely to be genetically more likely to have got breast cancer due to a genetic link than women are, which I didn't know. So for example, though I've had the test and mine isn't genetically linked, but my mother had ovarian cancer, and that is a marker that says, as her son, you know, I'm more likely potentially to get breast cancer. Clearly, the normal things of fitness, weight, obesity. Its age is very significant in men. I mean, Matt's a real baby in terms of
I'm a rarity.
age.
I'm a 1% of a 1%.
Yeah, you are, because I think the vast majority of the guys in the group are, I would say, definitely 60 plus. So yeah, it is. It's very much a disease of older men.
It's linked also to prostate cancer as well.
And prostate, interlinked.
Men that who have had a previous diagnosis of prostate, or the other way around, men that have had a diagnosis of breast cancer might be more likely to develop prostate cancer.
Yeah. It's worth mentioning actually another problem we have, and this is really important in terms of a message that we're trying to get out to people, is, you know, if there's a guy listening to this podcast and feels that they've got a lump in my breast, and they go and see their GP, it's really important that they don't allow themselves to be batted away by the GP. You'd be surprised how many GPs are not aware that men get breast cancer. And we've certainly had a couple of guys in the group who've had to really battle to get referred on for the checks when, the rules are quite clear. If in doubt, doesn't matter what cancer it is, you're supposed to go on a 2-week pathway, for assessment and diagnosis. The survival rate in men is lower significantly than it is for women. And the prime cause of that is twofold. A, because men don't go to their doctors in the same way that women do. As a gender, we are really bad. If we find something wrong, we'll put up with it. We'll start to boil, it'll go away. So that's the first problem. And the second problem is people making assumptions, and not dealing with things as they should do. So, guys, if you think you've got a problem, don't take no for an answer. Push and push and push, because they get to a point they haven't got any choice.
It's also, if you have a partner, you tend to live a little bit longer as a man, just because that partner will push and make you go to the doctors and do these things. So kind of it is super important. I was very unfortunate in the fact that I didn't catch mine early enough. So I know now that at some point cancer will potentially get me, or chemo might get me. So I kind of, if you take me as an example, you really need to go as early as possible. And if things get delayed, like they did with me as well, you need to be pushing every day, phoning, get your appointment, because 2 weeks, 3 weeks, 4 weeks might make a massive, massive difference.
Again, it's the message to the men out there. We're talking here about breast cancer. If you get a bad back that doesn't clear up, if you get a cough that doesn't clear up, doesn't matter what it is, after 2 or 3 weeks, go and get it checked. The one thing men seem to worry about is doctors laughing at them, or doctors saying to them, "You're wasting my time." That will not happen. But you've got to make the first move, and you've got to take yourself off to see the doctor.
The signs and the symptoms that men should be looking out for are the same as, or mostly the same as, what women should be looking out for. So the lump, the swelling in the chest or armpit area, any liquid that might be leaking from the nipple, any discharge, particularly if it has blood in it, changes to the size, the shape of the breast on either side. They might have sores, ulcers, unusual areas of kind of skin changes on the chest area, the shape of things, the shape of the nipple. Maybe it's inverted, like Matt had experienced. It might be a rash. Those kinds of things, all the same signs and symptoms that we would be encouraging ladies to look out for, that will frankly be plastered everywhere this month. And many men will hear that on the radio, they'll see it on the TV while they're sat in the doctor's or dentist's waiting area and the TV is playing or something in the background, and they'll just assume that doesn't apply to them. It does. And again, we are encouraged as women to know your body, check yourself monthly, know your normal. I would say that that's true for men as well. When you're, as men, you're encouraged to kind of check your lower half of your body. As women, you're encouraged to check your upper half of your body. Really, what we should do is know the normal for ourselves from top to toe.
And could you tell us some of your findings from your research, Kerry?
Really, what we found through the PhD research that I carried out was that a lot of what we're led to believe at lay level is, it's a bit of a lie, it's a bit of a fib. Men are interested in their health, men are interested in their bodies. Men quite often don't have a space and an opportunity to talk about what is concerning them about their health, or quite often what tends to be the case is, if we do have loving, caring partners and in our corner as a male patient, what happens is people will speak for their partners, or they'll go to a GP appointment and they might speak on their behalf, or at a clinic or something like that. Men have a voice, and men want to use that voice when they're given the opportunity to do so. And we've seen that repeatedly over the last 5 years through the VMU. Every time we have a new person who attends and they share their story with us, they'll tell us exactly what it's like to be a man with breast cancer. And psychologically, and I hope Dave and Matt don't mind me saying this, it can be quite harrowing at times. You are in this position where you don't quite know as a man where you sit and where you fit, because as we were saying earlier on, it's very much badged as being a female cancer when it isn't. The breast is very much seen to be part of the female body when it's part of men and women's bodies. And what we tend to see through the research that we've done is that men feel isolated and kind of cast aside in this breast cancer arena. And unfortunately, that's not just through clinicians who perhaps should know better and don't spot signs soon enough, or don't make referrals in the way that they might do when a female patient presents with these same symptoms. But it also goes as far into once men are diagnosed as well. And women might be in a space where a male patient is also invited along. So say that's an online forum, a chat room, it could be in the physical presence of a clinic or a support group. And men kind of sit at the periphery of the optimal care and support that women are readily invited into that space. And that can be hugely problematic for them in terms of their support seeking, their help seeking, whether that's pre-diagnosis, during, or after. There's this sort of assumption that men are quite okay with losing their breast, that it doesn't matter to them because it's not formed as well, if you like, or as well developed as the female breast is on the body. That the lack of symmetry or the changes to the body isn't the same. Hair loss doesn't matter because men potentially go bald anyway. All of that's rubbish. Men experience these issues in the same way that ladies do. The lack of symmetry on the body for some can be hugely problematic. It can cause them to change their behaviour and the activities that they engage in. So maybe they were frequent swimmers before, but they don't now like being shirtless, so they don't tend to go to their local gym or their swimming environments in the same way that they used to, or feel comfortable sat on the beach with their family and their children. All of these things, of course, there are adaptations that exist for ladies. We have prostheses where they can wear them inside the bra. We have inbuilt bra technology where you would never even know if a lady had had a mastectomy. Men don't have that opportunity in terms of a clothing sense. So the balance might be more, or should I say the imbalance might be more obvious than perhaps you might think, particularly if they've had to have quite substantial surgery and that mastectomy has removed quite a bit of the chest area. And again, the bodily identity, what it means to be a man, the masculinity side of things, having to explain to other men, male friends, male family members that you have a cancer that is predominantly known to be one that affects women. And, we've had men who have told us that they've thought up these elaborate stories to kind of share with male peers. So, I was attacked by, somebody when I was in the army, or I was bit by a shark. Somebody used to tell his grandchildren when he was a younger man.
Not because I was ashamed, just because I wanted my grandchildren to think that I was very brave.
I wasn't going to name you, Dave. I wasn't going to name you. But yeah, there are kind of stories and things, and some of them are more jokey, as Dave said. Some of them are absolutely serious. So there was one guy in particular who I remember vividly. He thought it was more preferable to tell people that he'd been in a knife attack because he thought that sounded more macho. It was more masculine. And that stuck with me. It's stuck with me ever since, and he was absolutely serious about that. He thought that if people thought that he'd been in an accident or an attack of some sort, that was preferable to people thinking that he'd had cancer. There's quite a lot, as I'm sure you'll be aware, victim language and the way in which people don't feel comfortable with that either.
Do you think that's generational in terms of I had no problem telling people I had breast cancer. Do you think it's because of the level of what a man was at a period of time? So if someone in their 60s currently, 70s currently is the person that's getting it, what they grew up as being a man is different than what I grew up as being a man. And
Absolutely.
So I feel it's a lot easier to come out and say, I've got breast cancer because I don't see a problem in it. Whereas actually someone that's 20, 30 years older than me, where it's seen as not being a masculine thing, it finds it a lot harder.
Absolutely.
I think it's
and I think
demographic.
it used to be seen as... Sorry, Dave.
I was going to say demographics as well, because I mean, I've shouted about having breast cancer, and I'm 60. I've lost count. 67, 67, no, 68. Just turned 68. And I've never had a problem with standing on top of the rooftops and shouting about it. But I think that's the demographic that I come from. So I come from, a very open military background where we were encouraged to talk. I stood in front of 2,500 police officers, told them that men get breast cancer, and I had no issue with it whatsoever. But I think people come through, and oddly enough, I think it could well be, for example, office environments, perhaps.
Yeah.
Yeah, so I think age is a thing because the generations do change, but I think it's also the nature of your background where you come from.
I do think it's
Um,
how we've changed how we think about masculinity and how we define that as well. So masculinity very much used to be seen as a singular thing.
yeah.
Masculinity now is plural. People can have lots of different versions of themselves in the same way as that's been acceptable for women to have various different roles and identities as part of their female identity for long, long time. We're now more accepting of that being the case and being true for men. So you can be macho, but you can still be the dad that wears the baby sling on the front of the body. You can still be,
Mm,
the guy that wants to do dancing with his wife and play rugby on a Saturday or whatever that might be. You can have lots of different selves as part of the individual, and your masculine self can, be portrayed in lots of different ways. So I think that as the ideas and the understanding and the way we think about masculinity has shifted and changed over time, that has certainly, without doubt, likely to have had an impact on the way that maybe some of the older men who are diagnosed later in life perhaps felt the need to maybe keep that a bit more privatized, be a bit more stoic about it potentially, whereas younger generations are certainly encouraged to share their emotional side of things and how things are affecting their mental health and mental well-being in a way that older generations simply just weren't encouraged to do that.
It's great to hear Matthew say that, actually, that you
Mm.
feel that, and
yeah.
as the next generation feels that. I think it's brilliant that you can say that.
Yeah, well, I think roles are more fluid as well. I like you aren't you aren't a breadwinner. You aren't like
Mm.
you've got so many different roles within a relationship now that kind of gender becomes a little bit more fluid as well.
Mm-hmm.
You aren't seen as being one thing. You have an opportunity to be many things.
Yeah, that's a great way of describing it. And I was thinking again about forensic settings and how lots of you talked about it being genetic as one of the sort of ways of it being passed. And lots of the men I've worked with in prison don't necessarily know either the mother or the father or both, usually the father they don't know. So lots of will have been in care, and so won't necessarily know their family genetics, as Dave was able to say about his mum's, but not everybody would know that necessarily. Um,
I think with genetics, it's important just to mention that realistically, um, by that, it's not something that you would. If I mean, I kind of made an assumption that because my mum passed away from ovarian cancer, there was probably a link. But actually, the only way you can be sure is to have the BRCA gene test, which you tend to get only when
Got cancer.
you've had the cancer. Now, what might happen is, for example, if my mother had had breast cancer and she'd had it within the last 10 years, then she would have or probably had a BRCA test. And then if she'd been diagnosed as positive, then I would have known in that sense. So the gene kind of or the the predilection to getting breast cancer because of your genetic makeup is still very new.
mm.
So there's a lot of things where you can absolutely say that, and it can be detected. With this one, it's still very new. Um,
It's amazing in terms of it gives people an opportunity to have
yeah, testing.
to be tested and to
Yeah,
be checked. It's also really harrowing having that test yourself because then you also have the problem of potentially, well, the solution and the problem of telling members in your
Mm.
family that they
Mm.
might get cancer or have cancer.
Or might pass
So
it to you genetically. Yeah,
yeah,
yeah.
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 So
Mm.
kind of it's a double-edged sword
Mm.
because you go, oh great, I haven't got it,
Mm.
and brilliant. But if I do have it, then potentially my nephews, my nieces, my sister, my brother all have to go and get checked. And great if they haven't got it as well, and perfect. But in the same token, you're then opening them up to a kind of this emotional roller coaster that you're already on.
I work with men in prison and in insecure settings and hospitals, and they wouldn't often necessarily have contact with their families to know these.
Yeah,
So that can be difficult because they're not necessarily looking for it or thinking about
yeah.
it. And how can sort of family and friends support people? I mean, what have you found helpful?
I couldn't have survived without mine. And that Kerry and I have had this conversation. I'm sure we have, because I've said the toughest when you once you get, Matt will agree, once you get swept up with this thing, you're on a journey, and you become so you're so wrapped up in your own journey. It's very easy to forget the people around you. So it was my wife, my partner then, who had to pick me up when I was down, who had to, went to Sainsbury's to get the odd food that I wanted to eat, rather than like ladies wanting to eat bits of coal when they were pregnant. Chemotherapy does that to you. And she'd go off and get whatever I wanted from me, or she'd get back and then say, "Well, actually, I've changed my mind. Can I have something else?" Because that's what chemotherapy does to you. And we often forget the people around us who do provide the support. Yeah, I couldn't have done it without mine.
Yeah, I completely agree. Rachel, my partner, has been absolutely amazing. And also kind of going through a lot herself because there's been points in my diagnosis where I've been told I probably have less than a year to live because my cancer was getting worse and worse. It was only until I had the targeted therapy that it started to get better. So she's been on this horrific roller coaster of emotions as well, and has been strong for me. And I've kind of it's really good that I'm good friends with her support network as well. So when I know that she's down and when I know that she's not right, I can get her friends involved to make sure that she's okay, which also is a benefit to me because then I know that I'm supporting her as well through it. Um, and like I wasn't sure what I could do and what I couldn't do at large parts of the journey. So I'd go for long walks, and a lot of the time it would be I'd go and see a friend, and we'd go and walk for several hours and like chew the fat, chat about whatever we wanted to, just take our mind off things, and having those people there to kind of get you through the good days and the bad days um, makes you feel like everything's potentially going to be okay.
I think there's quite a bit of research, not a huge amount, but certainly a body of work around why men whose wives or female partners have had breast cancer. What there is still very limited research on is the experience of women or partners of men who have breast cancer. And the support groups that tend to exist tend to be of the assumption that these are going to be male partners that might be seeking support as carers or supporters of men with breast cancer. They don't necessarily think of the flip side of that, where these people might be female supporters of men. So like Dave and Matt both said earlier on, their partners go along to the clinic with them. There is that assumption that they're the patient rather than the supporter or the carer. And again, that can feel quite alienating for these individuals who are there as the support source, the main support for those who are being diagnosed with breast cancer. So when we were talking a little bit before about things that can be done to maybe try and improve things, actually what we need to do in relation to male breast cancer is think about those who prop up the men who have this diagnosis, because every single person who I have interviewed in my research or come to know through the men's VMU, majority of them were partnered, whether that is a heterosexual couple, a gay couple, married, unmarried, but the majority of them have tended to be in couples. And every single one of them have said just how integral their partner has been throughout their diagnosis process and beyond. Where again there is even less research is for single people who have breast cancer. Again, there's some research and a body of work on that has looked into it from the female angle, but not so much from the male perspective. And understanding the difference and the types of support that will be absolutely critical to those people who unfortunately don't have somebody at home who can share this weight of this diagnosis, and perhaps discuss things, at the small hours of the morning when there's nobody else around to kind of do that. So there's a lot to that side of things, and I think there's a definite gap in the research there that could do with being fulfilled a little bit.
I think there's a useful segue here as we're talking about support into if some men don't have support in terms of partners, and the obvious place you turn to then is the support groups that are out there for breast cancer. And there's certainly been at least 2 or 3 of the men who've gone to support groups for breast cancer and basically been made to feel a little bit unwelcome. The women have not been, basically this is a female support group for people with breast cancer, and that's why the men's VMU is so critical. Because the only people who can really relate to another guy who's got breast cancer are the guys, and it's a very safe environment. Nobody's going to say to the guys, you're not wanted here because you're a man. And that's the power of the VMU. We do have 2 honorary men, of which Kerry is one. But the men at every meeting, the men have a right of veto. So if there's somebody wants to talk about something really personal, it's never happened, but they do have the option to say to Kerry, look, or they can let one of the moderators know that they want to talk about something which is a bit personal. So it's never happened, but we are very careful on that sense.
And actually, there's the WhatsApp group as well, which is great.
Yeah.
So with the WhatsApp group, I've asked loads of questions in there, and then individually people have messaged me and given me their answers. So whether it be what are the side effects to the hormone therapy that you're on, or what have you dealt with this? Because a lot of those have so much more experience than I do with the disease. Like I say, mine's coming up to a year in December, whereas some of these gentlemen have had cancer on and off for 10, 15 years.
Yeah.
So they have a wealth of experience in terms of what hormones they've taken, what has worked for them, what hasn't worked for them. And having that kind of resource is like, just one, stops you from feeling alone, like you're dealing with something yourself, and 2, gives you an opportunity to go and advocate for yourself to your doctor and say, oh, actually, I've spoken to 15 men and all of them have had these symptoms on this. What are my other options? I still want the use of my fingers. I know 10 of the guys in the group can't use their thumbs because the trigger finger that the hormones cause. So actually, what other options do I have, or can I limit the dosage on it, or what can I do with regards to still giving efficacy to the drug, but not taking away things that are really important to me in my life?
Also, for their partners to know that they have that outlet once a month as well. So we have met in person for the first time. We did that last year, and we invited along partners of the men as well. And what was really nice was, over one side of the room, the men gathered together, and over the other side of the room, we asked if the partners would sit separately, just initially, just so that the men had purely dedicated time to sit and chew the fat, to use Matt's expression, of just, being together in a space where there were double figures of men with breast cancer, because that is so unusual to get that number of men in a space together. It just doesn't happen. And actually, what was really nice was, of the handful of wives and partners that did come along, they sat the opposite side and kind of had the same conversation, but from their angle and their perspective of what it's like to be on the other side of this diagnosis. And really brilliantly, we've got the opportunity to do that again on the 18th of this month, and we're taking the opportunity to celebrate what is the 5th birthday of the men's VMU, to get the men together again and in person in London as kind of a neutral meeting point. And I'm delighted to say that many of them are able to make it, and we hope that many of their partners will come along too, because it's just such a brilliant way to get people together to talk about what is such an important, aspect of their life, but it's not the only aspect of their life. And I think that's really worth pointing out as well. Cancer is a part of their identity. Their identity isn't just that they are cancer patients. They're men who have lives that run parallel with this diagnosis. It's part and parcel of it. So yeah, I think it's really, really critical that they have this space and this opportunity to talk.
So how do people get involved with the VMU, and how would they sign up for the in-person event if there's still time?
Yeah, there's still time if it's for anybody who's kind of signed up to the men's VMU. So we have the men's VMU website, which is themensvmu.org. Is that right, Dave?
Yeah, I think it
I
is.
always get that wrong.
Yeah. But if you search the men's VMU, actually Google's quite good now. It does come almost at the top of the list. So literally the men's VMU will find us.
And I know in terms of resource as well, that you collaborated with Against Breast Cancer, who's a research charity for secondary spread breast cancer. You collaborated with them to do a men's breast cancer information leaflet,
Yeah.
which is sort of distributed, and I think sort of GP surgeries and sort of other businesses and things like have them, and they're also available on the website as well. What other resources or sort of links to support would you share here as well?
If you've lost a nipple, we've got a nipple tattooist on the books.
Yeah, the
I,
NIP charity. Yeah,
yeah,
absolutely brilliant.
I'm a very proud owner of a tattooed nipple. But they asked volunteers to do it, and of course, men being men, nobody volunteered, so I kind of put my hand up. So I ended up with my nipple tattoo, which I'm saying I'm very proud of. So, but there's lots of actually there is some quite good support groups in there. We link in with the Male Breast Cancer Alliance, which is a much bigger group in the States. So they have the advantage of numbers. So obviously their population is like 10 times the size of the UK, and they have 3,000 or 4,000 people in their group. So that proves to be a very useful resource.
I think from my perspective as a researcher, I think one of the biggest challenges is persuading research funders to provide funding for male dedicated research in this area. So whilst we know that proportionally more men die from breast cancer than they do from certain male cancers, we know that whilst it's only, to use Dave's term earlier, 350 to 400 men each year, approximately 80 of those men will lose their life each year. So these numbers, they might sound smaller, but they're not small. And for us to kind of improve in terms of health equity and to reduce the health inequalities, particularly in the realms of breast cancer, what we now need is for funders to start to fund male dedicated research in this area, or certainly for there to be an arm of research that looks solely into what are the causes and the links behind the illness in men, and not just it kind of being an offshoot and a byproduct of what we learn through women's research. There needs to be proper funding and proper focus on the disease in men for us to learn more about this in order to save more lives.
Yeah, I think from my perspective, I tend to try and end anything like this with the same thing, and I've already touched on it, and that is guys out there, if your body changes, go get it checked. 2 weeks, 3 weeks, if it doesn't go back to normal, not just lumps in your breast. If you're not right, get it checked. It will save your life potentially.
Potentially, if I had noticed things earlier, I wouldn't be in my situation that I'm currently in. So it's poignant that actually get yourself checked, because um, you might not get a terminal diagnosis, which is if anyone wants to understand that, is that I will be on chemo for my whole life, and my whole life will
Mm.
be drastically shortened because of the chemo. So if there's any reason for you like to understand that how important it is, I'm an example of it.
Well, thank you so very much for taking your time out today to sort of share your insights, and to everyone who's listening and watching, please, this is really important. Do help us, to raise awareness of male breast cancer, this Male Breast Cancer Awareness Week and beyond. And all that leaves us left to say is let's talk forensic psychology.